So here's a quick outline of what we are going over today. We're going to go over 211 basics. I just want to make sure we're all on the same page. How 211, 988, and 911 can work together. That has been a hot topic of recent. We want to talk a little bit about 211 and disaster, and then dig right into social determinants of health and how we use 211 in partnerships to serve the most vulnerable among us. So I'm going to start with a quick ad campaign. This was a national campaign, so just give me a sec.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
211, how can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources, call 211 or visit 211.org. 211. Get connected, get help.
It's so fun to share all of the things that we get to do, including where our national ad campaigns take us. Definitely want to tell you more about what we do here in Michigan. 211, although a national organization, in Michigan, we're a little bit different. So we are a complete statewide system. As of 2017, every single county in Michigan has been covered. And many counties have been covered for like 20 years. It just took us some time to get everyone on board, but we are so excited about the work we get to do together. In Michigan, we are a public service, and we are mandated to be 24/7, 365 days a year. Folks can reach us in many ways. Still, the most common way people reach out to 211 is picking up that phone and dialing those 3 digits. But in Michigan, we also have the opportunity to text. You can send your zip code to 898-211 or TXT211 for those folks who are a little cooler than some of us. You can also chat with us online. Although that commercial shared the national site, if you go to the national site, it will take your information and direct you to your local 211, to one of those 7 centers that serve here in Michigan. And you can also find that pretty easily at my211.org. We've made it as simple as possible to share information in Michigan. And we're going to talk more about all of that stuff. I wanted to, again, address how we're working together for Michiganders. 211, 988, and 911 are 3 distinct helplines. Their services, they're very different purposes, but we want to make sure that you understand 211 is a helpline that provides information referrals to various community resources and services, but it's a non-emergency number designated to connect people with appropriate assistance. 988 is the national number designated for mental health crisis intervention and suicide prevention. It provides immediate assistance for individuals experiencing mental health crises. Collaboration with 988 and 211 in Michigan is outstanding. We are helping all day, every day, to make sure that 988 has access to our directory at 211 so that if they're talking to someone who may need information and referral services, they can get people right to our information and referral. As you know, 911 is an emergency number for immediate assistance in life-threatening situation. It's crucial for rapid response from law enforcement, and we actually have 911s in our state that have both a 211 and a 988 button, where they can get people right over to the service at 211 or 988 if it's needed. By working together and coordinating efforts, 211, 988, and 911 can form a comprehensive support network that addresses a wide range of community needs, really a holistic look at how do we support Michiganders. During disaster, we have one other quick video. We have more than that because it's fun to watch.
No matter what, no matter when, 211 is there
Free, anonymous, confidential. 24 hours a day, 7 days a week. A friendly, compassionate place who can connect you to the resources you need. When life happens, 211 is there. 211. Get connected. Get help.
So during a disaster, the 211 network not only helps communities and families get connected to social and health services, but it becomes vital in responding to disasters. As you saw in the opening of that very quick commercial that was created actually in 2020 after the flooding in Bend, Michigan. This was created locally right here in Michigan and has been shared all over the country. But we wanted to make sure that folks knew during a crisis, they should not be dialing 911 if they want to know how FEMA is contacted or how to report damage. That's where 211 steps in. We have seen huge increases in utilization, certainly even in the COVID response. In the past few years, 211 has helped Michigan disasters, including over 12,000 contacts for assistance when there was flooding in Southeast Michigan back in 2014, 23,000 calls for support with 12,000 scheduled water deliveries in response to the Flint water crisis. In 2018, we helped in the Upper Peninsula Houghton flooding. I could go on and on and on. I will share with you in that May of 2020, 5 central Michigan counties experienced a historic 100-year flood, and that impacted where I'm sitting right now in Gladwin. Our 211 center had help from as far away as Florida. This 211 network that we have nationally supports each other. During Hurricane Ian, Michigan 211 even provided additional capacity for the Heart of Florida 211. We work together as a team to make sure that we're serving people when they're vulnerable.
No matter what.
Before we get into specifics, I want to make sure you understand that 211 acts as a central hub that connects individuals with a wide range of community resources. We provide information on services related to housing, food assistance, employment, education, healthcare. I could go on and on and on and on. We offer navigation services, providing intensive assistance to individuals, especially those facing complex social needs. Navigators work closely with callers, helping them understand available resources, providing personalized guidance, and ensuring that they can get the support they need. You all know that we need to make sure there's a no wrong door approach. When someone shows up in need of assistance, we don't want to turn them, well, we don't have that resource here, so let's send them somewhere else to see if there's resources. That's why we really try to make sure everything is in one hub, because also the other thing we know is rarely do people have one need. People have multiple needs when they're struggling. So 211's resource directory, our data management and navigation expertise collectively contribute to a community health improvement framework that is comprehensive, data-driven, and focused on the underlying social determinants of health. This is where I believe we fit so well and sometimes don't get the recognition. When I first came over to 211, when I was hired, I said, this is public service, this is health improvement. And I am so excited that we're making that connection today with you all. So let's start with our resource directory, or as I like to call it, the resource directory in Michigan. Yes, I am very proud of the work we do. The resource directory that 211 holds is of immense importance for various reasons. We play a crucial role in supporting individuals and communities. Michigan's 211 directory has 7,455 agencies that represent over 30,000 programs. I looked at our data just one time, and in about 12 months, when I ran this quick information, we updated that resource directory over 80,000 times that year. And there are times when it's even higher than that. The 211 resource directory serves as a centralized and accessible source for a diverse range of community services. Individuals can find information, again, on all of those things that we have listed, and the breadth of this information ensures that individuals can address multiple aspects of their needs, which is what we need to have well-being. The directory is regulated and updated to ensure that the information is current and reflects evolving landscapes of available services. We make sure these updates are as timely as we can make them. When I ran in one of the 7 contact centers, I said, pick up the phone and dial. If something changes, you get a new service, something happens and you're overwhelmed, you can't take referrals, call your 211. We want to know, because we don't want to send people to a place where they're not going to get help either. 211 directories are often tailored to specific regions, addressing the unique needs and resources available in local communities. This localized approach, especially that we have here in Michigan, enhances cultural sensitivity and acknowledges diversity of our communities. In times of emergency or crisis, the directory becomes a vital tool for quickly connecting individuals with essential services. For example, when there's a warming shelter, you don't want to make sure that everyone has to get onto Facebook to hear it. You don't want to make sure they have to be able to tune into the 11 o'clock news to find out where their warming shelter is. Call 211. Make sure that you have an agreement with your 211 in emergency situations so that people have one place to go to find information. The resource directory also fosters collaboration among many service providers in a community. By connecting all kinds of community-based organizations, each of them can focus on their specific area of expertise. Thanks to the state of Michigan, we're working on the technology to federate, which is a fancy word for share, our directory, and to get other folks to share their directory with us. That's what a federated directory is. We're hoping, for example, that maybe Laura has a list of licensed, whatever that might be that Laura keeps. There may be a time when we need that information for service providers, and we don't want to keep that all at 211. So sharing that directory is the best way to use everyone's time. Really, it's important to understand that the resource directory held by 211 is a critical tool that not only provides information, but also serves as a catalyst for positive community development, empowerment, and meet the diverse needs of individuals and our communities. Our data, my friends, our data, it is just so awesome, and it's rich. Those responsible for planning, budgeting, administering programs like SNAP, which is, hopefully you know, our supplemental nutrition assistance program, or unemployment benefits, can use 211 data for modeling, maybe even for projections. The data aids in tracking the demand for social services, allowing for accurate allocation of resources. Agencies like FEMA value that real-time data that 211 provides in an emergency. What zip code may need clean water at this point, or they're looking for food. They can drill it down to the exact needs almost in real time. Elected officials, we're going to get to that, but there's insight into constituent needs. Often 211 is being used to make sure that we understand what people need and how do we make policies that reflect that. Nonprofit organizations and service providers, philanthropic organizations can all use 211 data to inform strategies, to inform community health improvement. The data from 211 serves as a versatile and invaluable resource that informs decision makers, emergency response agencies, elected officials, public health departments. It doesn't matter. Our 211 data, I really believe that if you're on this webinar today, there is a place where our data can serve you and the work that you're doing. Here's an example of data from 211 in Michigan in 2022. As you can see, 2022 was a busy year for us, about 818,000 requests for help. You can see that we have requests for food, housing, the list goes on, and we can break all of this down. We have new numbers coming from our 2023 data, but we usually hold on to those until our very, very special day, until 211 Day, which this year we're sharing with the Super Bowl. They didn't ask our permission, but we are sharing our day with our Super Bowl. So please keep connected so that we can share our 2023 data with you. What you should know, though, is that in the country in 2022, 211 handled about 50,000 calls per day. So we have a wide variety of information nationally. If you have an organization that crosses state lines, how do we work on this together? How do we share that data and make sure that you are seeing what you need to see to serve people the best way possible? I want to share with you this really cool piece of technology that the team at 211 Michigan has created. This is my211.org/legislators, and each legislative district in Michigan can pull comprehensive data from their district. Right now, you see district number 9. You see exactly how many connections were in this given time period. You see the total needs, unmet needs. An unmet need typically means we could not find an appropriate referral. We also track why was it unmet? Was it because of transportation? Was it because that service just is not available in the community? Again, incredibly rich information that we just can't wait to share with you. Our navigation expertise. These are the people. This is why I get so excited about 211. We have nationally certified teams all over Michigan. 211's navigation services involve personalized approaches all over Michigan. Highly vulnerable callers may lack resources and connections that our navigators can help identify. They can bridge that gap between what someone needs and what they have the capacity to handle right now in their situation. While we know that referrals are valuable, vulnerable callers may struggle to follow through on their own. So navigators can go beyond referrals. They can provide ongoing support when allowed and when it's necessary to ensure that individuals take actionable steps towards securing assistance. 211's navigation services play a crucial role in providing intensive help to highly vulnerable callers who may face significant challenges in acting on social needs referrals independently. The people who serve, I always say, if you pick up the phone and you dial 211, that person you get is going to be the smartest person at 211. They know so much. They really do understand our communities in ways that are profound. That's been a lot of talk from Sarah Kyle. Yeah, I'm so excited. Esperanza, thank you again for joining me. And I am going to hand this over to you. Please let me know when you'd like me to advance your slides.
Will do, Sarah. Thank you. I'm going to set my timer over here. Hi, everyone. Happy SDOH month to you all on the call. So by now you have heard Sarah talk about how community can connect with 211, how 211's navigation support is responsive and works with other significant helplines like 988 and 911, how 211 addresses communities' urgent health and social needs, and how when you power that with data and stakeholder engagement, 211 can play a really important role in addressing those community conditions that influence our quality of life and how long we live, otherwise known as vital conditions or social determinants or influencers of life. I love being on the call with so many people who have public health backgrounds, just like Sarah. We share both a passion and background in public health. So I'm happy to be with you all today. What else? You've learned about 211 and the importance of bringing 211 to what I think of as the community health improvement picnic. Community members can use 211 data to understand what resources people are seeking and how well our communities are addressing people's needs. You probably don't see this, but I work at a dual local 211 and local United Way. But our call center and resource teams work together hand in hand in real time to improve the quality of information in the resource database or directory. This happens because of something that Sarah mentioned earlier, not just because of what 211 learns during calls, but also because 211 employs locally and our teams know and understand our own communities. The last thing I'll say here before I ask you to advance, Sarah, is that I hope that by now we all understand at a high level the value that 211 can bring to your local efforts. Sarah's contact information as well as mine will show toward the end, and we would be happy to work with you and connect you to your local 211. Over the next few slides, I'm going to touch on some examples of 211's promise for the future, which really focus on enhancing connections between people, organizations, and services, all of which really depend on the foundation of 211's role in community, which are all, again, powered by local and state partnerships. Slide. So again, my guess is that you're part of this webinar because in addition to wanting to learn more about 211, you also have a job or personal call to action that drives you to be part of community, to play a role in something bigger than you or your organization or department, and to one day leave your community better than how you found it. I think of my organization's involvement in various community health improvement processes in Southeastern Michigan, which again is another topic that Sarah also addressed earlier in the presentation. So while many partners have varying definitions of community information exchange, I'll shout out the Michigan Department of Health and Human Services and give their definition here. They define CIE as a localized effort to create and sustain the technology and relationships required to support social determinant of health needs of both individuals and community. CIE maximizes a person-centered approach by ensuring social care information is collected only as needed and is stored safely. CIE also promotes streamlined access to health-enhancing non-clinical services, helping to coordinate care across a variety of clinical and non-clinical partners while using data on existing community resources, needs, and gaps to drive policy change. So it's a very long definition. If you look at the slide though, this is how we talk about CIE in our organization and community. We really see the goals as follows: that needs are matched to available services in a seamless and dignified way, that agencies are more connected to one another and have an easier time sharing information, and that care planning, allocation of resources, and policy solutions are more informed and equitable. And I think these are all things that everyone in this room can probably agree are things that we are working on and toward together. And so I would say many of us are probably involved in CIE-like or CIE-adjacent activities. Among many required capacities of CIE, so think of those little bubbles on the slide as those different capacities, a resource directory that or database that Sarah mentioned earlier is really key. Information about community resources needs to be accessible. This information is a critical element of CIE infrastructure. It enables people to know what resources are available, to whom, and how to access them. Directory information needs to be comprehensive and it needs to be reliable. There needs to be process rules and, importantly, culture in place for how the information is kept up to date and the quality of information remains high. And this information needs to be worked with and managed and used by people in community where families, friends, and neighbors connect and use these resources daily. And so while you might be thinking of different interfaces or systems as a CIE, what I would encourage you to think of CIE as is an ecosystem that is really comprised and made up of partners with different roles and capacities based on the capacities of your community. You all know that 211 is a statewide network. So our local 211 in Southeastern Michigan is part of United Way for Southeastern Michigan. My team and I have been working with partners to build a CIE for over 5 years now, and we've worked with partners to create an explainer video that I'd like to show that really emphasizes the importance of resource directory infrastructure that is accessible across partners, or that we hope to one day be truly accessible across partners, systems, and available for different types of use. Slide.
Communities are powered by their networks and connections. Sharing information, skills, and perspectives enables people in those communities to take complex problems and find solutions. But for organizations, there are often gaps in our communication that limit our connection to each other. And when we aren't connected, it makes it harder to provide services and care to those who need it most. For example, let's say this is Maya, and Maya shows up to a health center, and while community health worker Alicia conducts a needs screening, Maya explains that her food benefits have recently run out. Alicia takes a few minutes to research local food resources, and after a few minutes of searching, she finds an address to a food pantry that she passes on to Maya. So Maya travels to the pantry, but unfortunately, it's not a food distribution day. So she travels home and researches the food pantry's distribution hours and compares them with her own schedule. On her day off, Maya again makes the trek to the pantry and starts another client intake process. When the pantry coordinator hears that Maya is struggling with rent, he does his best to search for agencies that could be relevant to Maya's situation. Eventually, he provides a phone number to Maya. Later, when Maya calls the number, she's asked to again share her story and personal information. Unfortunately, Maya doesn't qualify for assistance at this agency, but she's given another phone number for a separate agency that might be able to help. There is an enormous opportunity to improve the way people are connected to resources by strengthening how organizations share information. Created, owned, and informed by people and organizations like you, a community information exchange is a model first developed by 211 San Diego that helps organizations better serve people. It's not just one centralized database or a specific software. It's a unified network of partners, connected by an infrastructure that supports them and providing coordinated, dignified, and seamless care. It does so by increasing exposure of social and health services through a shared resource directory. It allows a client's profile to be matched to available services they are eligible for, enabling information sharing and managing consent to safeguard privacy. Building on the foundation of 211 and existing relationships, organizations across southeastern Michigan are joining together to create our own community information exchange, Connect for Care. Now here's how Maya's story plays out with Connect for Care. As Alicia learns that Maya's food benefits have recently run out, Alicia can quickly search and find an eligible food pantry only a few blocks from Maya's house. With Maya's go-ahead, Alicia books a new client appointment on the spot, and Maya receives an email with the date of the appointment, along with required documents and the address and phone number of the location. And later, when Maya arrives, the pantry coordinator already has Maya's information from what was collected by Alicia. And when Maya mentions that she's having trouble with rent, the pantry staff can quickly find resources that Maya qualifies for, can see which agencies are accepting new clients, and easily send over a referral. But what's potentially the most exciting is that this is happening across the entire community, helping us understand in real time what needs exist and where networks and connections are working well. Now community members and organizations can work together to advocate for policies and resources that in turn create impact and over time change the system to be more equitable. If you'd like to learn more or join the CIE efforts, visit unitedwayscm.org/CIE.
Great. So you can stay on this slide for a little bit and I'll tell you when to advance, Sarah. So this video shows a vision of what we are working toward together, using community assets to strengthen connections between people and organizations that are doing really tremendous work in our community. Michigan 211 is building infrastructure to support CIE connections and partnerships statewide. So hopefully this video that we made in our community helped you to see 211's foundation and infrastructure that really supports local relationships and community resources. I mentioned a picnic earlier, and so I'm going to come back to that metaphor here. But while 211's role in every community looks different because of local context, due to the infrastructure they are building that is interoperable, so systems can connect with one another, I'd like to ask that you think about inviting 211 to your community health improvement work. Earlier in my slides, I talked about this picnic, and during picnics, we build community by sharing and breaking food together. How we bring that food to the picnic is important. We might bring a basket, we might bring a cooler, or even a grocery bag. Maybe it's just a lunchbox. But regardless of what it looks like, its function is to package food safely and efficiently, and that remains the same. And so while 211's role might look a little different in every community, I encourage you to think of 211 as an important partner in understanding local community needs, resources, and an enabler of data and information sharing that can help enhance your response time and connecting people to services. They can help you capture critical information and feedback to strengthen your community, and also can help power analytics about unmet needs and improve investments. And with that promise, well-being over time. So please feel free to connect directly with Sarah or me after this presentation about how to go about this. Over the next few slides, and Sarah, just interrupt me if I go over time, but I'll be highlighting some examples of what this looks like in different communities across the state. All right, you can go to the next slide. All right, so again, these are just some examples that we wanted to highlight of 211 helping to support CIE in different communities. So working with the home visiting programs in Michigan, 211 created a landing page for people to learn more about available programs, as well as act as a self-service page that can lead to electronic requests for services, sometimes referred to as referrals. So the home visiting programs that 211 worked with actually sat with 211's database curators and quality experts to determine what the landing page should have and what would work best for the families they serve. They were part of nearly every decision you see on that page. If you navigate to that website, you'll see what I'm talking about. And you can see that they were part of all the design of those screening tools and the questions that that we as a network thought would be most appropriate to be asked. Importantly, 211 has also been working with local partners like ours, like us, to think about and plan for other pre-eligibility screening that with a small set of questions can very quickly and efficiently match people to services they're eligible for, such as SNAP assistance. Slide. Thanks. The Kinship Care Resource Center serves kinship care families across the state by providing information and referrals to support caregivers and the children they are raising. KCRC also offers support to professionals serving kinship families. The Kinship Care Resource Center has direct access to the Michigan 211 Resource Directory to offer an online self-search feature on their website to aid kinship families in locating up-to-date resources in their community. Additionally, through this partnership, Kinship Care Resource Center is able to capture data from their website visitors to identify search trends, commonly searched programs, gaps, etc. The 211 directory is pulled from in real time on the Kinship Care site, saving their team from creating, updating, and the thousands of hours of work that it takes our different directory teams to put all this information together. So another thing I'd like to highlight here about 211 is our network's ability to work with you and train you on how to use their service lookup tool. I'm really fortunate in my position to help support our resource team in Southeastern Michigan and love watching them in action as they train other organizations to help their clients navigate resources using the 211 directory. Our team is resourced to keep the directory updated, and we are constantly communicating with community partners about new or retired programs. Help us help you by requesting a training, and we can support the integration of this kind of navigation into your existing workflows. The last thing I'll say here about this slide is the kinship care team at MSU worked alongside the Michigan 211 team to use taxonomy or language that made sense to them and their families. We took their lead on how to make our directory results work for their families around this particular resource. Slide. This is another example of really great work that's happening and being supported by 211. The Jackson Care Hub is a regional CIE collaborative that uses the Riverstar Community Care Hub to screen patients for needs in 12 distinct social determinant domains. The platform was developed using an inclusive, community-based technical design process to first identify that shared vision that is really key and important to community health improvement work, to identify goals for the services, and then to understand how community partners would integrate their work into their existing activities. And finally, to design a technology solution that supports the community's goals, information pathways, and individual partner workflows. Henry Ford Health Allegiance Hospital and its affiliated departments and clinics complete roughly 70% of the screens each month, with the rest completed by private practices and nonprofit agencies, including Central Michigan 211. 211 continues to work with Jackson County and the team at Henry Ford Health to make this process better for the people they serve. And you can see a snapshot of data from that partnership and the work that partners do together on the slide. Slide, please. Another program is called Wise Woman. So Wise Woman is a series of programs in Michigan that focuses on prevention of cardiovascular disease among women. During their screenings, they find that many of their women have additional social determinant or health-related social needs. So now, thanks to the technical infrastructure that 211 has been working on, with clients' permission, Wise Woman programs can request services directly from 211 navigators for follow-up. Additionally, and this is it's a little different than what I just mentioned, 211 agents can, with the permission of their client, actually send clients' information directly to Wise Woman programs of women who are looking for this service. So then after this happens, 211 agents can continue providing that one-on-one support that they do so well, aided by this new referral pathways that increase the likelihood of getting people connected to services that they are seeking. Slide. Connect for Care Community Information Exchange, or CIE, is how we are beginning to refer to our work in Southeastern Michigan, which is some of what you just saw in the video that I shared moments ago. That image on the right-hand side comes from the video, and to me really shows the connections that can be made when building your efforts from the foundation of 211 and solid community partnerships. We want that strengthened sector where people and systems are resourced and connected to support seamless, effective care. Another thing that's special about us that I mentioned before is that we are that dual 211 and United Way. And so because of that, we are really able to combine our partner stewardship and community investments, our client services work, which includes 211 and connections to the Michigan Energy Assistance Program, Water Residential Assistance Program, and our team of social navigators. So all of those things in combination with our CIE integration work, through all of those working together, we are really working to build that more coordinated and connected system. In our work locally, our CIE helps to connect people to food assistance, tax appointments, childcare assistance, transportation assistance and wraparound support, utility assistance, and then our team of social navigators are also able to provide further support and connections as part of the client flow that we have established in our organization. So I'll note here too that we worked with and continue to work very closely with our participating partners to listen, design, and build with them every step of the way. In integration work, and those of you who have that public health background might be more familiar with the source, but I remember reading something about, it's a quotation that really shows and shares how to build a system that works well for more people than it does today. You really have to take things apart to put them back together. And so for us, what that's looked like is really deliberate and direct conversations about how we want things to work. It includes assessments about partner capacity, training, data use agreements, et cetera, all of which we continue to work on as part of the 211 network and in partnership with the Michigan Department of Health and Human Services. And I think with that, Sarah, that concludes my talking points.
And you all can understand why we are blessed to have Esperanza join us today. You rocked it, girl. Thank you so much. But there's a lot of things. So there's a couple questions I think we can unpack together. If anyone has more, please feel free to put them in the chat. I am going to put our contact information up as we answer a few questions. Is that okay with you, Esperanza?
Yes.
We want to make it easy to get a hold of us, right? And I would say, if you forget, Sarah Kyle or Esperanza Cantu, there is one easy way to get a hold of your 211 team, and I'm sure you all can imagine how that would happen. Pick up the phone and dial. Your local team, depending on what county you live in, offers so much valuable resource. There's a question about, Esperanza talked about some of the work in Southeast Michigan. What's happening in Southwest Michigan? I have a private message about Northern Michigan. I want you to know your 211 wants to be involved in this work. We really do. And that can be in any phase, but the earlier the better. And, you know, invite us, save the date for the picnic because we want to help. We want to hear your community. We take very seriously that community information exchange starts with community, right? So we want to be part of that conversation with you. Picking up the phone and dialing. You can connect with me, you can connect with Esperanza. I'll get you to the right person, but we definitely want to be part of those conversations. And again, when it comes to that training, I have always loved that piece of our work, is that we want to get outside of like kind of our walls. So how do we train you to use either our directory, how do we make things work for you? We are a public service in Michigan. We want to serve you. We want to serve Michiganders along with each of you. We're excited to share that. So I would pick up the phone and dial. I would email me and I'll get you to the person who might be able to offer you. Some of our centers have free material. They'll email you. We have all kinds of really great resources. It's really easy to get, picking up the phone and dialing. So there's some questions. More information on training, I would definitely say pick up the phone and dial, or email me and I'll connect you with your local center leadership. We'll make sure that you have what you need. When it comes to statewide trainings, we do have a training director and we work on some statewide stuff, but we want to make sure this is local, right? That is what we know is very powerful. This is not a team that doesn't understand your community. So we want to do that for you. Service navigation is not just to telephone and online. We have 211 teams who show up at events, to help out. We have I mean, you really connect with your 211 team to find out how we can work with you. I can't tell you that we can be at everything. We are not all things to all people, but we are a public service in Michigan. So reach out to your 211 team. Make sure that you have made friends with them, that you've kept them on the invite for your picnic and for your open house and all the other things. We want to break bread with you. We want to serve communities together. I'm trying to look at the other questions. There is a specific question, Esperanza, about Oakland and Macomb. That might be something you might be able to address. I don't know the specifics of what's happening in those communities, but we're making sure that we're we want to have those conversations. The barriers or limitations that we've encountered, helping other people connect resources, providing referrals. You all know those barriers very well. Transportation, allocation of resources. And those are things that, again, if you contact your local 211, they should be able to get you information on what is unmet in your community and why it's unmet. Esperanza, do you want to address any of the Oakland or Macomb questions?
Yeah, thank you for highlighting that because I was scrolling through the chat looking for it and I found it. And I'm going to, Catherine Smith, I am going to send you a personal chat because I want to confirm the information with our 211 team before. We know and understand that transportation to food banks has been a huge barrier for the clients that we serve. And we know that there are many partners that are working together to find a set of solutions to help support that. But I will follow back up with you via direct message. And then if there's an FAQ or something that we can send out, Sarah, afterward, I'm happy to share information that way also.
Perfect. Thank you. I'll also tell you the web search at my211.org, our database is there, and it is mostly the exact same thing that people search who are internal. There are some organizations, they have the ability and the right to say we don't want our information showing up on a public website, so they may not show up in a search. I always tell people if you're searching online and you get to the screen that says we're sorry, there's nothing that we could find, pick up that phone and dial, because those people who are answering those calls, really, they may be able to find something that's a one-off, or that food pantry that did not want their provider's name and phone number on a public website. But for the most part, yes, what you search online is exactly what we're searching when we're doing the internal search. Has 211 help promote public health policy change? Oh, my friend, Whitney Smith. Yes, we are working all the time on really understanding policy and how it affects the most vulnerable. As you can imagine, most callers to 211 are vulnerable, and we believe it's part of our role to protect and to speak for them when given that opportunity. We want to make sure that their voices are heard with all of our lawmakers. So you have a 211 team member who has gone all the way to DC and pounded on legislators' doors, because we want to make sure people understand that we are serving vulnerable populations, and they really need to understand what that means to the average caller in Michigan. So yes, we work on the legislative level all the time. There's a specific question about an event in Battle Creek. Rebecca, I would love for you to email me that information, and I'll get you connected with a local agency to see if we can get someone there. That's going to be on, we want your local to be as connected to you as possible. We do have 211 for non-English speakers. We have a translation service. At all of our centers have to have a translation service. Many of our centers have more than one language that they live answer. Spanish is the most readily available in the state of Michigan, but there are many languages that are available. Please make sure that your folks understand that we're going to do our very best to serve every Michigander, no matter what language is spoken, no matter what way we can get a hold of them. So I think I may have addressed most of the questions. There's one more. Is any of the 211 data reported publicly available? Yeah, that legislative site is for you too. That is as public as we can make it, as putting on the website. We also have plans to even put more data on our website. So stay engaged. Visit us at my211.org. check us out. We're going to share as much information. If you want more specific reports, again, pick up that phone and make a relationship with your local 211. We love sharing our data. We love reaching out to our communities and being there to support you. So please pick up the phone and dial, email me, and I'll connect you with your local 211. Or if it's a statewide organization, please feel free to reach out to me directly. You can reach out to me directly no matter who you are, because that's what we're here to do. We want to make sure that we're making those connections. So with that, my friends, I don't see any more questions. I can't thank Julia and Darian enough, the state of Michigan, for setting this up. I'm excited about Social Determinants of Health Month. I'm really excited about our stuff happening next week in the state of Michigan. It's exciting. I can't thank you enough, Esperanza, for joining me on this journey. And please feel free to reach out to us at any time.
Thank you, Sarah and Esperanza. We will send out a follow-up email with the slides and a recording of today's presentation. Thank you, everybody, for joining.